Hi, my name is Alexis Polly, and I'm going to be going over a series of skills today for my Med-Surg 1 class. But before I get started, I just want to go over a couple of things. For all of these skills, I'm going to be gathering my equipment and checking my medication orders and doing a couple of different things with every single skill. So I just want to make that very clear in the beginning and go over a couple of very important steps that I'm going to be taking with each skill. It's going to be a little bit different doing this at home versus in the clinical area, so I just want to be absolutely certain that I do hit those points. So when I do each and every one of these skills, I am going to be gathering my equipment, making sure that I am checking each and every medication against the order in the health record, and making sure that I'm checking it against the faculty or facility policy rather, and then clarifying any inconsistencies that may be occurring and checking the patient's health records for any allergies that they may have. I'm also going to know the nursing actions and special considerations that might be necessary for that patient with the medications and procedures that I'm going to be doing today. The safe dose ranges, the purpose for the administrations, and the adverse effects of the medications that are being administered. I need to also consider the appropriateness of the medications for these patients. Performing hand hygiene, I will state that while I'm doing these skills and just say, hey, I performed hand hygiene. So that's also a very important step that I will be stating. And just moving the medication or supply system while I gather all of my medications. Since I don't actually have the medication supply system in front of me, I'll just state that, I have gathered this medication from the supply system. I checked it against the MAR, but there is a 3-check system process. So when I say the 3-check system process, you are to, it's a safety concern for the patient that a nurse does. And the nurse checks, whenever the nurse gives a medication, the nurse is going to check that medication against the medication order whenever the nurse is getting the medication ready. Then the nurse is going to check the medication against the chart to make sure that it is the appropriate medication that they need to get against the MAR. And then it's the final check is whenever they go into the room, or against, depending the facility, but most of the time whenever they get to the patient's room, and then they check it against the patient to make sure that they have the right patient. And you do that with 2 patient identifiers, whether it be scanning the wristband and asking the patient, hey, what's your name and date of birth, or just saying what's your name and date of birth. You could do this by multiple kind of things. Just different patient identifiers, but you need to at least have 2 patient identifiers just to make certain that you have the right patient, because that's very, very important. You never want to give the wrong medication to a patient. So these were just some things that I wanted to make sure that was very clear that I'm doing with each and every skill that I'm going to be going over today, just because where they are kind of repetitive with each and every skill, and I am performing them at home and we don't have exactly all the equipment. I just want it to be known that way I don't have like an 8-hour video that I'm going to be posting here. So I just wanted to make sure that I have like a little snippet in the beginning to kind of summarize that. Also, another very important thing, whenever I am doing all of these skills, it is very, very important that I am documenting in real time. So right after I am doing these skills or administering this medication, whether it be oral medication or an injection or nasal spray or sub-Q injection, IM, intradermal, I need to document in real time. That way, if something were to happen to the patient, or we know when it happened, we know the time crunch when we have to do something about it, or what has happened to the patient if something were to happen, or when the next dose is due, that kind of thing. Also, that way we can evaluate the response that the patient's having to the procedure, which is also a very important step.